This short video is meant to serve as a brief introduction to family-centered rounds. Family-centered rounds is the way that your doctors, nurses, and other members of your hospital care team communicate the plan for the day to you and your family. It incorporates the 4 principles of family-centered care: dignity and respect, information sharing, participation, and collaboration. In the past, we used to think that the best way to care for patients was to make a daily plan with a group of doctors talking in a conference room. When this happened, patients and families were out of the loop, and doctors sometimes missed valuable pieces of the story.
Then we had an idea. What if doctors and nurses discuss the plan for the day in real time in the room with the patient and family? This way the family will know the plan for their child earlier in the day, can help tell their child's story to everyone on the medical team at the same time, can ask questions and get answers from the medical team, and can clarify things that don't make sense.
Once we changed our way of doing things, everyone benefited. Now, family-centered rounds is widely practiced here at Hasbro Children's Hospital. When your child is in the hospital, the team will round in your room. For families who speak a language other than English, the team will always round with an interpreter.
Families always have the option of not participating in family-centered rounds. There are times when the family may wish to skip the day's rounds. For example, the team can be a large group, and even though we're all friendly and nice, the group might intimidate your child. If it's been a difficult night, you may want to sleep or let your child sleep while we round. Or there may be sensitive topics that are better discussed in a small group without the entire team.
There may be times when your care team feels it is better to meet with you one-on-one rather than with the full care team. In these cases, we can round outside the room, and the resident and attending physician will come into your room and talk privately. Most of the time, though, families enjoy this part of the day and find it very helpful. We hope you will too. We thought we'd show you an example of family-centered rounds in action.
Come in.
Hi there. Good morning. How are you doing? We're the medical team here to do family-centered rounds. Is now a good time?
Sure.
Great. So I'm just going to introduce the whole team. So I'm Dr. Kerr. We met early this morning. We have Dr. Takun. She's our senior resident. Dr. Alverson is our attending, so he's the doctor in charge. And then Heather, she's our medical student. You guys met this morning too. You know your nurse, Tracy. So Heather's going to update us on what's been going on.
So I'm going to kind of recap what brought you in and then talk a little bit about the plans for today. Feel free to interrupt or add anything at any time, or if something doesn't make sense, feel free to ask questions, okay? So Emily is a previously healthy 11-year-old female. She came in when about 3 days ago she developed pain with urination and some fevers, and then yesterday started having nausea, vomiting, and was really unable to keep anything down.
She's also having some back pain too.
Oh, okay. Thank you for adding that in. So yesterday her mom called the pediatrician, and the pediatrician suggested that they come to the ER because she really wasn't able to keep herself hydrated and the pain was worsening. When she got to the ER, she was quite tachycardic.
What does tachycardic mean?
Oh, good question. Tachycardic means that your heart rate was going a little bit faster than it normally would. And that's probably because you were having fevers and you were dehydrated. So in summary, Emily's an 11-year-old female. She's here with pyelonephritis, which is a kidney infection. And since she's been here, she's been improving after being given antibiotics and IV hydration.
Oh, good.
So today our plan really will be to continue the antibiotics. We'll wait for the urine culture, which will tell us what type of bacteria is causing the infection, and then we can figure out which antibiotics she can go home with. And we'll keep treating your pain and nausea. And then if she's drinking more this morning, Tracy, I think we could probably turn down her fluids. What questions do you guys have?
When can I go home?
I think Emily can go home as soon as she's able to drink a little more on her own and when her pain's better.
We'll plan to check on you both in a few hours, but please let us know if you need anything else before that.
Thank you.
We recognize that it's difficult to have your child hospitalized for any reason.
We hope that through family-centered rounds, we can partner with you to provide the best care possible for your child.